With many of New York's usually bustling spots virtually empty, the state's governor says there are some indications that the strict restrictions on social distancing could be slowing the spread of COVID-19.
This past Sunday, the projection was that hospitalizations were doubling every 2 days. On Tuesday, the projection suggested that the hospitalizations were doubling every 4.7 days. Now, that is almost too good to be true.
All the patients in this room.
But the situation in the country's most densely populated city remains dire. An emergency doctor shared video with the New York Times from inside a public hospital overwhelmed by cases of COVID-19, describing the situation there as apocalyptic. With 200 dead in New York alone, state officials have warned there's a need for thousands of additional ventilators as more serious cases come in. In New Orleans, Louisiana, where just a month ago people crowded Bourbon Street for Mardi Gras, there is a growing concern it could become the next epicenter for the virus in the U.S. The city has seen a 30% jump in cases in just 24 hours.
So what we need to focus on now is the fact that we are several weeks post Mardi Gras, and we are starting to see that spike. And what the governor has indicated is that we're on a path to look like Italy.
Louisiana is one of several states that have issued stay-at-home orders, but the Trump administration has not signed on to a nationwide order to keep people at home. Against the advice of his own health experts, President Trump continues to insist that the cure can't be worse than the problem, and that he'd like all Americans to be back at work by Easter.
Now, meanwhile, last-minute